Hi friends, today we are going to discuss telemedicine practice guidelines of India. This guideline was released by Ministry of Health and Family Welfare on 25th March 2020. Myself, Dr. Suresh Padadmat, Head of Telemedicine Center, Professor of Psychiatry, NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. If you require any legal opinion, please do contact advocate. This presentation is not a substitute for legal opinion. And also I request you, please do refer to the original document of telemedicine practice guidelines available on Ministry of Health and Family Welfare. Please do regularly check if there are any updates on this guidelines. What to do when a patient initiates a teleconsultation for the first time? As per this guideline, first consult means the patient first time contacting the RMP, or else the patient had contacted the RMP but it was more than 6 months back, or else the patient has contacted 2 months back for diarrhea and now he is calling for cough. So there is a two different health condition. In all this scenario, it is called as first consult telemedicine. Patient initiates the telemedicine consultation either sending an SMS or an email, or he can make a phone call or a video teleconsultation. Once he has done it, once he initiates the process, there is an implied consent is taken. It is accepted as per the guidelines. Once the doctor receives either the email or by a phone call or a video call, the doctor has to ensure the patient identification. He may ask for a registered ID, maybe Aadhaar card, maybe PAN card, or any valid photo ID card as per the Government of India. And immediately next he will go to the next step. He will quickly assess for is there any emergency care is required. Yes, if it is required, the doctor will ask him to get the first aid done to the patient, and he will refer him to the appropriate maybe to the nearest RMP or to the nearest hospital. No, if there is no emergency requirement, he will continue with the detailed assessment. The detailed assessment may be either taking the history, collecting information, asking for investigation, asking for if the doctor feels that yes, this person has to undergo general physical examination, he will ask for general physical examination. And during this process, he may feel, no, the patient has some acute emergency condition. He may again refer the patient to the nearest RMP or else to the nearest hospital. No, if there is no emergency, he will either do one of the management. What is that management? He may consider for health education, he may give counseling, or else he may prescribe medication list under list O. No, if the patient is being on video consultation, the doctor can prescribe list A. So these list A, list O, I will come to shortly in another video. What to do when a former patient initiates a teleconsultation? This is called as follow-up consultation. What does it mean? It is follow-up here. If the patient within past 6 months, he has consulted you in person, face to face, real life consultation has occurred within the past 6 months, then it is called as follow-up consultation. Again, the consultation should be for the same health problem, not for the different health problem. For example, if the patient has consulted for diabetes, this consultation also should be for diabetes. If it is for headache, then it will be considered as a new consultation. Along with this, telemedicine guidelines also is very clear. If the RMP does not remember or does not recall the patient that he has consulted, then it will be considered as again a first consultation, not a follow-up consultation. So to quickly recap, the follow-up consultation means the patient has to have consulted the doctor by in person within the past 6 months for the same health condition. Again, the process is similar. The patient will initiate by sending a text message, email, or a phone call or a video call. As soon as he does it, it is called as consent implied. The doctor will identify him. He will ask him for the ID card. He may ask for photo ID. He may ask for a registered mobile number and if the doctor is convinced it is the same patient, he will go ahead with the consultation. If he feels no, I'm talking to a different patient, he will withhold the telemedicine consultation. No, the ID is proper. He will quickly assess for is there any emergency situation. If there is an emergency situation, he will advise for first aid. He will do an appropriate referral to the nearest RMP or to the hospital. If there is no emergency, he will continue with the detailed assessment. Again, the detailed assessment during this process, you will either do health education, you will do counseling, and everything is fine. He will do the refill of the medication, either maybe the list A or maybe list 2. And for example, if the patient has not improved and he requires some other medication, medication list B will be there. So refill of A or B, or else in the follow-up teleconsultation, medication list B gets added. By chance, if the patient comes with a new complaint, it will be considered as new consultation. This is what is follow-up consultation means. The question is, can a caregiver initiate a teleconsultation? Yes, this telemedicine guidelines clearly says that caregiver can contact RMP for telemedicine consultation, especially if the client is a child. The caregiver is allowed to contact the RMP. If the client is an incompetent person, like person with dementia or severe mental illness, the caregiver can contact the RMP directly. In such scenario, if the caregiver is contacting the RMP, whether there are two scenarios here, whether the patient is with the caregiver or if it is not there. If the patient is there with the caregiver, either you take the consent of the patient and go ahead with the caregiver discussion. No, the patient is not there, then you have to consider before you continue for the telemedicine consultation. Is the patient is minor? Is the patient is incapacitated? Is there any formal authorization letter from the patient? And you have to verify the relationship between the patient and the caregiver. Or else, if the doctor is very convinced in the previous in-person consultation, the patient has recognized the caregiver, then he can go ahead with the telemedicine consultation. The next question is, can a health worker initiate a telemedicine consultation? Yes, health worker can definitely initiate a telemedicine consultation. Here, as per the telemedicine guidelines, following people have been considered as a health worker: a nurse, allied health professional, mid-level health practitioner, ANM, or any other health worker designated by the appropriate authority. Where from this teleconsultation can be initiated? From any health establishment, from health camps, home visits, mobile medical units like from the ambulance, or any community-based interaction. See, this guideline has been wonderful from this perspective. It has been made very patient-friendly. Can the health worker contact private establishment? Of course, yes. It gives a complete freedom for the health worker. Either he can contact the private or the public establishment. But there is some condition it has imposed. Health worker should have seen the patient, should have done the assessment by himself, should have taken an informed consent before contacting the RMP. And once he is clear about this, he will call the RMP and ask for a consultation, so called as telemedicine consultation. And the process will be starting the same. Once the health worker makes the call, again RMP has to verify for the ID of the patient. And then the remaining process same. Either it may be first consultation or it may be a follow-up consultation. The next question is, can a RMP initiate a teleconsultation with another RMP? For example, a PHC doctor or a doctor from primary healthcare wants an opinion from a doctor from medical college or from a tertiary center. Is it possible? Yes, of course. This telemedicine guidelines gives a complete freedom for a PHC doctor to ask for consultation from the specialist from a higher center. Such consultation will be considered as consultation initiated by an RMP based on his professional judgment. But however, the RMP needs to seek patient consent before proceeding for a consultation over telemedicine. And along with this, the guidelines also cast the treating RMP shall be responsible for the treatment and other clinical responsibility. That is very essential here, because the specialist who is sitting in a different place may not be able to know, follow up and do any kind of monitoring. So the complete clinical responsibility will be on the PHC doctor who has initiated the telemedicine consultation. To conclude, RMP can now provide telemedicine consultation for both new patient and also old patient. This telemedicine consultation can be email, can be text message, can be WhatsApp message, can be audio, phone call, or maybe video call. And this telemedicine guidelines is going to be the game changer and is going to change the way we are going to practice the medicine. This guideline is very simple and it is patient friendly and any RMP can use it. I request all my fellow doctors, please do adopt and adapt to provide the health services to the patient in need. Thank you very much.